Today I'll be doing my narrated PowerPoint on CPR, cardiopulmonary resuscitation, how to perform CPR. What is CPR? CPR, which is cardiopulmonary resuscitation, is a life-saving technique useful in many emergencies, including heart attack or near drowning, in which someone's breathing or heartbeat has stopped. It's far better to do something than to do nothing. Things to ask before you start CPR. Obviously, you want to tell if the person is unconscious or conscious. If they are conscious, obviously you want to ask them questions, whether maybe it's heart attack related. Ask them, the clammy skin. Just ask if they have any feelings of issues in their chest. You obviously want to ask if they're okay. If they're unconscious, just go ahead and start with the 911. You normally want to have more than one person and have someone call 911 and possibly grab an AED if they're in the vicinity. I know there's a state law with every state or federal building that you have to have at least an AED within a certain amount of feet of a common area. We'll get into compressions. Compressions are how we restore blood circulation. First, you want to put the person on his back, his or her back, on a firm surface. You don't want it to be any kind of flimsy surface, or you're not going to get good compressions. You want to kneel next to the person's neck and shoulders. You place the heel of one hand over the center of the person's chest between the nipples. Place your other hand on top of the first hand, keeping your elbows straight, and position your shoulders directly above your hands. On this, you want to keep a good grip, a good, firm, steady grip. Keep your elbows slightly bent, but able to put a lot of pressure on the chest. Sometimes you may, if you have to get into this situation, you may have or feel maybe breaking of the ribs, something like that. If you feel that, you go ahead and kind of stop. You don't want to puncture anything with a broken rib. And leave it to the professionals. Use your upper body weight, not just your arms, but you want to use everything. You're going to make a triangle basically with your both hands, arms, and your chest, your upper body, and you want to press down, straight down on the chest, at least 2 inches, and push hard at a rate of about 100 compressions a minute. Airway. Obviously, we want to keep the airway open. When we revive, to keep the air, they're going to come back and start needing some air real quick, and they're going to take in a bunch of air. So you want to use the head tilt, chin lift maneuver, and that is putting your palm on the person's forehead and gently tilt the head backwards, and then with the other hand gently lift the chin forward to open the airway. You do this basically at the same time. You want to check for normal breathing, taking no more than 5 to 10 seconds, and you want to look for the chest motion. Listen for breathing sounds and feel for the person's breath on your cheek and ear. You also can, kind of like how you check for which way the wind is blowing, kind of get your finger wet, and you can tell if the person's breathing, whether it gets cooler, the moist part of your finger gets cooler, anything like that. Now with the breathing, with the airway open, using the maneuver we just talked about, pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. They do make breathing tubes, masks. I got to go when I was active duty to a search and rescue swimmer school, and they do have the big masks where you can put a certain piece down into the mouth, kind of get your air flowing straight down to the lungs. You want to prepare to give 2 rescue breaths. Give the first rescue breath lasting 1 second and watch to see if the chest rises. If it does rise, give the second breath. If it doesn't rise, then you need to give a harder breath. 30 chest compressions followed by 2 rescue breaths is considered 1 cycle. If the person has not begun moving after 5 cycles, which is approximately 2 minutes, and an AED is available, apply it and follow the prompts. Now, an AED is real easy to use. Even anybody without any training can use it because it comes with directions and most of the newer ones now tell you exactly where to place everything and what to do and when to do it. Administer one shock, then resume CPR until there are signs of movement or EMS, police, or any kind of emergency medical personnel are there. In conclusion, I just want to reiterate that it's far better to do something than to do nothing at all. If you're fearful that your knowledge or abilities aren't 100% complete, remember the difference between your doing something and doing nothing could be someone's life. This PowerPoint should aid you in CPR procedures when or if you need them. And basically, you can anybody could do this. You don't have to be a trained professional. CPR is super easy. It's just getting over the fear of hurting someone or anything like that, because it's literally could be their last lifeline. So